morning, everyone. Welcome to Webinar 4. I am Dr. Riza Lorenzana, Chair of the Ako Para sa Bata 2020. The 12th Ako Para sa Bata is presented by the Child Protection Network Foundation and UNICEF. Our theme this year is Care of the Child Against Violence in the Time of Disease. The Ako Para sa Bata 2020 webinars are a service to the Women and Children Protection Unit members and the entire Ako Para sa Bata community. We are deeply grateful for your support. So I will now turn you over to the moderator of the 4th Ako Para sa Bata webinar. So she is an associate professor at the Ateneo School of Medicine and Public Health. She is the head of the outpatient department of the Department of Pediatrics in East Avenue Medical Center, a medical specialist too at East Avenue Medical Center, and a consultant at the Medical City. May I present to you the moderator of Child Protection 101 for Physicians, Dr. Edna Sara Clemente Morada. Over to you, Dr. Morada. Good morning.
Good morning. Yes, good morning, Rizzy. Thank you so much. Well, you can call me Didi or Doc Didi. Right, that's my nickname. So again, good morning, everyone. Our dear Ako Para sa Bata community, the attendees logged in Zoom, and those watching via Facebook Live, welcome. The 1% that's outside the Philippines is my sister who's watching us right now. She's from Colorado. Hi, Cora Dolittle, special mention. We are glad that you could join us today. This is the 4th webinar of Ako Para sa Bata 2020. As mentioned by Dr. Riza, a total of 23 webinars will be presented by the Child Protection Network Foundation and UNICEF. Please follow the Ako Para sa Bata social media accounts, flash on screen for updates and other announcements. And if you'll post about the Ako Para sa Bata webinars, please include the hashtag COVID APSB 2020. All right, we now come to the meat of the matter. Today's webinar is Child Protection 101 for Physicians. Even if you're not a physician in the audience, you still can benefit from this talk. The objectives of this webinar are to analyze the consequences of COVID-19 on cases of physical abuse and corporal punishment, explain the process of recognizing cases of physical abuse during the COVID-19 pandemic, and our speaker will discuss the impact of COVID-19 on the management of cases of physical abuse. The speaker would like also to display the roles of physicians in the delivery of care to physically abused children during the COVID-19 pandemic. And lastly, we would like to cover enumerating the anticipatory guidance which should be provided during the COVID-19 pandemic. The program is flashed here on screen. It's a 1.5-hour session. A Q&A portion will follow after the two speakers have presented. But even if in the middle of the speaker's presentation, you may also type it already. For the open forum, we will choose among the questions in the Q&A box. Again, if you have questions that you want the speakers to address, please type them in the Q&A box, not in the chat box. We will also try to answer questions posted on Facebook live stream. Thank you. Let's begin. Let me introduce to you now our first speaker. Right, I'm so excited to listen to her. Our first presenter is the head of the section of pediatrics of the Women and Children Protection Center, Vicente Soto Memorial Medical Center, and the past president of the Philippine Pediatric Society Cebu Central Visayas Chapter. Ladies and gentlemen, let's all welcome Dr. Marian Naomi Navarro Polka. Hello, Dr. Naomi.
Hi, Didi.
Yes, there you go. Right. You're in Cebu right now, right?
Correct, that's where I practice.
Yes, and your place is famous for danggit. Ah, di
Yeah,
ba?
of course, the
Yes.
dried fish. Yeah.
Yeah, when I
Or
visit
and the
you.
lechon. Don't forget the
Oh yes,
lechon.
the lechon, Rico's lechon, and so many. That's right.
Yeah, that's
Now,
right.
Naomi, I'm so excited to
Hmm.
listen to your talk, and I'm pretty sure the audience as well is so excited. So let's move on. I give now the floor to you.
Okay then. So good morning, everyone. So I've been tasked to talk about recognizing and how to manage physical abuse and corporal punishment during COVID-19. I have nothing to disclose except to tell you that the pictures and the illustrations that you're going to see in these presentations are not mine. They were not created by me. So credit should go to their credit to those who created these pictures and illustrations. So today, although Diding had mentioned already the purpose of our talk, I shall talk about the consequences of child abuse and corporal punishment, giving us the reasons why we need to recognize these cases. Social isolation has truly impacted the management of child physical abuse, but doctors can still deliver care to those who are physically abused despite this imposed quarantine. Now, because of COVID-19, we all had to stay home, socially isolate ourselves to help stop the spread of the virus. Social isolation is an identified risk for child abuse. Quarantine and social isolation have brought about loss of physical contact with friends, teachers, counselors, extended family, people who can give social and emotional support to children while under their watchful eyes. And teachers have been found to be frequent reporters of child abuse. So they're no longer there. Social isolation has brought increased stress on parents and caregivers who may be facing uncertain access to food and housing, trying to make both ends meet, or maybe even experiencing job loss, having childcare problems, difficulties with schedule changes. And definitely, parental stress is a major predictor of physical abuse. Isolation increases the children's exposure to domestic violence and or to substance abuse disorders of their parents or caregivers. And domestic violence and substance abuse in the home are two risk factors to child abuse. Furthermore, there is loss of financial or caregiving support from the community, including the religious community and school resources, another risk factor. And another risk factor for child abuse is the loss of access to health resources, including mental health, for the parent, caregiver, and child. People feared going to hospitals that were designated as COVID-19 hospitals. They were afraid of catching COVID-19. And potential patients told us this when they were told that they had to come to our center for medical examination. Because of the COVID-19, during the enhanced community quarantine, we could only accept acute cases. Now we see patients by appointment, giving priority to acute cases. Pre-COVID, we were open 24/7. Now we're open daily from 7 a.m. to 11 p.m. Add all these risk factors to an IATF policy that says any person below 21 years old and 60 and above are quote and unquote required to stay in their residences at all times, except when indispensable under the circumstances for obtaining essential goods and services or for work in industries and offices. Children don't obtain essential goods or services. They don't work. They cannot stay out of the house. So the COVID situation at home is a high pressure environment where emotional and situational stressors are heightened and where there are minimal protective barriers for victims because places to seek safety are unavailable. So, is staying home safe or unsafe for many children who are exposed to additional factors just mentioned. For Filipino parents and adults, other adults in the family, the way to rear children is by disciplining them. And the most common disciplinary method used is physical punishment. According to Ramiro et al., 75% of Filipino mothers spank their children, 60% pinch them, and 51% hit their children's buttocks with an object. Our laws support the way, next slide, the way parents discipline and punish their children, as long as it is moderate in character and will not constitute physical or psychological injury. Interestingly, parents who cause serious physical injuries to their children will not suffer the higher penalties called for in this law. And what are these serious physical injuries about? These are those inflicted on the child who ends up insane, blind, imbecile, impotent, can't talk, can't hear, can't smell, can't see because of a loss of an eye, or we lose a hand or a foot, an arm or a leg in the name of discipline. The next slide will show us a table of the different severe and moderate forms of physical punishment reported in the Philippines. And so you can see the various ways that our Filipino mothers have been reported, parents have reported how they physically punish our children. Okay, let's go to the next slide. Unfortunately, the anti-corporal punishment bill was vetoed by President Duterte in February 2019. He said that corporal punishment can be administered in a self-restrained manner in such a way that the children remember it not as an act of hate or abuse, but a loving act of discipline that deserves only to uphold their welfare. So, discipline, aka corporal punishment, is a legal thing to do by every law-abiding parent. Therefore, it is of no surprise to learn that 66.3% of Filipino children, or 2 out of 3 of them, said they suffered physical violence, mostly in their homes, inflicted on them as corporal punishment by their parents and siblings. More boys were physically abused than girls, but if you look at the difference, actually there was not much difference between boys and girls. Rates of abuse and exploitation have been seen to occur during previous public health emergencies. The COVID-19 is nothing different. So Great Ormond Street Hospital in UK saw close to 1,500% increase in abusive head trauma from March to April 2020 as compared to the same period in 2019. Children's hospitals in the US have reported an increase in number of child abuse cases as well as an increase in severity. In Ireland, the Childline Service received close to 73,000 calls, texts, online messages from children self-reporting about self-harm, anxiety, suicide, domestic violence. You can already sense that something is not right at home. There has been an anecdotal evidence from China of a significant increase in cases of domestic violence against women and children, and we already know that domestic violence is a risk factor for child abuse. Now, between March, at the start of the lockdown in Cebu, and September, we saw 2 cases of abusive head trauma proven by cranial CT scan, and the first one had also a linear and depressed fracture in the parietal bone. And very recently, one suspected abusive head trauma in a 1-month-old child with a huge bruise on his face who expired in the emergency room, and a 1-month-old with an oblique fracture on the left thigh. We had not encountered a fracture in a baby in a long time, and it probably was about 2 years ago when I saw an infant with abusive head trauma. So with these encounters alone, I think it's safe to say that more children are being physically abused at home during this COVID-19 pandemic. But But children are not only abused at home, they're also abused by local authorities outside their homes for violating the curfew. So some of them had their hair cut, walk naked, then yeah, they were made to walk naked. Some were even put in a dog cage and made to sit under the noon sun for several hours, and 2 children were locked up in a coffin and publicly humiliated. So do you think this physical punishment or corporal punishment is good for children?
That's right, Naomi. No, looking at the last picture that you showed us, parang kawawa, no? Para silang mga animals put in an animal cage. So it's what we call a double whammy. Okay, so apart from the homes, physical abuse is done to our children, no? Not only by those loved ones who are present, because our government is saying stay at home, and also by our law enforcers when they are found outside. So tell us, are there effects of physical abuse to our children? And what are these effects? And how about corporal punishment, which you mentioned? How does it affect our young ones?
Okay, so if we're going to use the definition of corporal punishment as behaviors that do not result in physical injuries, such as spanking or slapping, the effects would include immediate compliance by the child. Yeah, they'll immediately stop what they're doing, but do you think they will completely stop what they're doing? No. Because studies have shown that this kind of compliance did not increase in the moral internalization of norms and social rules, which actually is a goal we want our children to achieve in adulthood. So this did not increase. Other effects include erosion of the parent-child relationship. I mean, if it's a hurting relationship, you think that's you're really going to have a fine relationship with the parents. So I sometimes ask my students, like, okay, who among you wants to know their children's crush when you're a teenager? Because if you want to know their crushes when they're just a teenager, then do not hurt these children, your children. There's the development of antisocial behavior during delinquency and criminality in adulthood, and even, yeah, mental health problems, because there's, physical abuse, corporal punishment, that's aggression, so you teach children aggression. And corporal punishment has been seen to escalate into physical abuse, where injury is inflicted on the child as a result of kicking, punching, beating, burning, shaking, etc. Now, children who are maltreated in this way have a high probability of developing mental health, ill health as children, as adults, as well as physical ill health in adulthood. So you have depression, anxiety, PTSD, anger. Many will develop risky sexual behavior, suicide. And physical ill health will include, just developing allergies, asthma, arthritis, cardiac problems. Some even have cancers. And they're gonna complain about a lot of pain, a lot of aches and pains. And when a doctor examines them, there's really nothing wrong with them. And of course, there's early death. And this association of adverse childhood experiences, which includes child physical abuse, with the negative effects on the physical and mental well-being in adulthood has been studied many times over. The brain's neuroplasticity allows it to be shaped by experience. It is proposed that adverse childhood experiences disrupt the normal development of children's brains, leading to social, emotional, and cognitive impairment. Because of this impairment, the child who is now an adolescent or an adult adopt health risk behaviors, making them prone to disease, disability, and social problems, and even early death. Hence, the importance of recognizing child maltreatment if we want our children to become physically and mentally healthy adults. But how do we do this when the children are at home? It'd be nice if we could have drones that can view into the houses of these children, but I think that's illegal. Or possess the X-ray vision of Superman or Superwoman, or the ability of Professor X to read and control minds, but we have neither. So, talino ang gamitin. Sabi ni Dr. Tony Dan's in his talk, Quarantine Beyond the Pandemic. We physicians are in a unique position to inquire about a child's home environment, offer support and promote child's welfare, development, and safety, as we often have a relationship with them. As physicians, we continue to interact with our patients during this pandemic by opening our COVID-safe clinics, or doing house calls, if that's what you want, or doing video calls. We need to see what's happening inside the home. But first, we need to know who the vulnerable children are. These are the children with known risk factors to child abuse who may experience an even greater risk of physical maltreatment during the pandemic because we're all socially isolated, such as infants are at high risk for fatal non-accidental injuries like abusive head trauma, and this has been recorded. Children below 4 years old, the toddlers are at risk, but based on our annual reports to the Child Protection Network between the years between 2014 and 2018, children between the ages of 10 and 15 were the ones who were mostly seen in all the various WCPUs in the country. Males are at greater risk than females to be physically abused. And we look at some children because some of them have special characteristics that places increased demands on caregivers, which may outstrip their capacity to meet the child's needs, increasing stress levels, thereby increasing the likelihood of maltreatment, such as those who are mentally and physically handicapped, those with chronic physical illness. Children with different temperaments, disabilities, or behavior problems may elicit frustration and stress on the part of the caretakers, which may result in physical abuse. Mind you, behavioral problems are seen in both abused and neglected children. It is believed that low birth weight, prematurity, illness, or physical or mental handicap in an infant or child interfere with attachment and bonding and make the child more vulnerable to abuse. Not much is known about cognitive or educational deficit. They can impact if they can predict maltreatment. Also consider children who have missed their immunizations or scheduled visits with you, the physician, their physician. Then we assess for the absence or presence of risks in the family. To monitor how the family is coping during the pandemic, ask questions like to mom and dad, how are you doing today or nowadays? How are you both doing? How's it going for the two of you? How are things going with the children? What do you and your children do to get through the day? Who do you call? Where can you run to if you need help? Speak with the children alone if possible, but definitely speak with the teens alone. Ask them essentially the same questions, including if there's anything that's bothering them or anyone who's not being nice to them. If the parent insists to be around, do the children look to the parent before answering your question? And at the same time, be observant. Does the mom look to you? How does the mom look to you? Tired, haggard, defensive? How do children look? What is their demeanor? Do they look withdrawn, anxious, fearful? And if you're doing a video call, does the house look more than just messy to you? Can the mom or dad seem to control the children's behavior, or do they seem to be over-controlling their behavior? Do the children seem to listen to mom or dad? Is dad lurking around, looking unfriendly, not making himself available? Unless he's out working, okay? So, like a detective looking to solve a case, which in this case is it child abuse or not? We ask ourselves these questions as we take the history from the parent or caregiver. Is the history plausible? If not, what then is the plausible history? We need to be aware that there are physical injuries where the only known biomechanics is abuse. Histories given by parents or caregivers can be seen in the next slide, will be vague, poorly explained, or they will deny knowing what happened to the child. Others change their narratives as they try to explain the injuries. Others will give information that's not compatible with the injuries as to the pattern, timing, and developmental ability of the child. Others will blame another child for the injury. I tell you, they always blame another child for the injury. A history of multiple emergency room visits for injuries, frequent changes of primary care provider, and signs of delay in seeking medical treatment are other red flags that we should all watch out for. If there are red flag signs to watch out for in the history, abusive physical injuries will also have telltale signs. Bruises are the most commonly seen injuries in physically abused children. Bruises accidentally sustained are seen on the bony prominences of the face, in areas that are accessible to play, such as the elbows, the knees, the shin bones. Bruises found on the torso, the back, the calves, the abdomen, the medial and posterior aspects of the extremities, front, back of thighs, ears, neck, cheeks, periorbital area are signs of abusive trauma. Bruises can come in patterns. So you can have a handprint that's on your left side of the screen. You can have bite marks, upper center of the screen, loops from double overed cord on the right side of your screen, and they can come in different ages and sizes and can be seen bilaterally on the child's body. That's in the center of the screen lower. And if you're going to look at the right side of the screen lower picture, one should be highly suspicious of abuse when bruises are found in babies who cannot even walk. Burns are uncommon in our country, but we do see them as cigarette burns. I saw one 11-year-old boy many years ago whose father used hot burning charcoal to burn the soles of his feet down to a 3rd degree. Luckily for our children, we do not use hot water to take a bath in. So the tendency for immersing their feet and or their hands in hot water as a form of physical punishment is probably rare. Scalp burns, such as splash injuries, may be intentional or non-intentional. It is important to consider, among others, the scenario where the incident occurred, particularly where the hot liquid was situated and its amounts, the child's development, if he or she is tall enough, or if he or she is capable of getting to the hot liquid, and if there are other people in the room. Now, babies who suffer abusive head trauma present to the emergency room with neurological manifestations, with no clear history from the parents, or maybe some history of trauma. But many of these babies will not show external signs of injuries. Doing a fundoscopy in the emergency room will help because the presence of retinal hemorrhages is a sign of abusive head trauma. The bulging tense fontanelle is one manifestation that will make you want a cranial CT scan. If it reveals subdural bleed, then we know we have a baby who was shaken, resulting in abusive head trauma. So let's see, what happens when a baby is shaken?
The size of a normal toddler or infant's head is larger compared to their body than that of older children and adults. In addition, young children have relatively weak neck muscles. As a result of this and other factors, young children are particularly susceptible to injury from the violent, sustained shaking that characterizes the syndrome. This animation demonstrates in slow motion the multidirectional nature of the forces generated during shaking. This is a view of the brain from above. Much of the blood from the two hemispheres drains into a large vein called the sagittal sinus that runs from front to back across the top surface of the brain. The sagittal sinus has multiple connections to the brain tissue called bridging veins. These veins run through the dura and arachnoid membranes. During violent shaking, the brain is moving within the skull. The dura and sagittal sinus cannot move as much because they are attached to the skull. As a result, bridging veins can be torn. Blood from the broken bridging veins can then accumulate in the subdural or subarachnoid space.
So that's how it happens when you shake. So always consider child physical abuse when a baby has a serious head injury. Consider child physical abuse when a baby has a serious head trauma from an alleged fall of 4 feet or less. Let's go to fractures. When infants and toddlers present with a fracture and a vague history, then physical abuse should be considered. Age is an independent factor in determining whether fracture is accidental or abusive. Just like a child who cannot bruise when he can't cruise, the less mobile children are not expected to sustain fractures, and the most commonly inflicted fractures are the skull, the tibia, the humerus, the posterior ribs, and the femur. Now, diaphyseal fractures, the ones in the center, right, are non-specific. They occur in both accidental and non-accidental injury. Now, a fall out of bed will not usually produce this kind of diaphyseal fracture. Like a transverse fracture is obviously caused by a direct blow to the child's femur. And a spiral fracture is the result of twisting forces. And they are very uncommon, again, in young children, not from a simple fall. Posterior rib fractures are pathognomonic of child physical abuse. They are not evident usually in the radiographs that you get right away, but in the acute stage, but are seen in the healing stage as a result of callus formation. So what you see here are callus formation already of the posterior rib fractures, and you do not get posterior rib fractures from CPR. Skull fractures are common child abuse injuries as well as in accidental trauma. But patterns of skull fracture that suggest child abuse are multiple eggshell fractures, occipital impression fractures, fractures that cross sutures, and fractures that are wide. Again, age is a factor when considering a fracture, whether a fracture is abusive or not. Again, non-mobile children should not have serious fractures or any head injury for that matter. Next, seeing healing fractures that were not set is highly suspicious of child abuse, and callus is not seen earlier than 5 days after a fracture, usually being formed after 14 days. Now, the corner fracture is caused when a small piece of bone is avulsed due to shearing forces on the fragile growth plate. It's usually associated with the shaken baby syndrome, because when babies are shaking, you know, the limbs, they shake, so the shearing forces against the on the ends of the long bone. So likewise, they can also have can suffer buckle handle fractures caused because the bone has been avulsed from the ends of the long bones. After serious head injuries, abusive injuries to the abdomen, in the next slide, is the second most common cause of death from physical abuse. The victims are commonly toddlers and will commonly suffer injuries to the viscera, more frequently to the duodenum, with liver and pancreatic injuries, and in 80% they will not show any abdominal bruising. Whether with face-to-face interaction or online consultation, we take the history and watch out for the red flag signs and risk factors I have just shared with you. Children who do not look well or will have suffered a fracture will be brought to your clinic or to the emergency room. Physical examination to look for these injuries with suspicious for abuse should not be a problem in these cases. It will be limited with the use of telehealth technology. You should then observe for the distress in children and caregivers. Take notice of the relationship between the children and caregivers. If you see suspicious injury or suspect physical abuse, ask the parent to bring the child to you for a well child checkup, or do a house call if you care to do that. Document your findings. Write the narratives from the parents and children verbatim. I like to tell the residents, history taking here is very easy, because all we need to do is copy the answers of the parents and the children to our questions. Use body diagrams for easy reference for the injuries. And if you can, take properly labeled pictures. Request for laboratory exams that will depend on the child's presentation. Work up for bleeding and clotting factors if the child has a lot of bruises. Diagnostic imaging for children with serious head injury, fractures, and abdominal injury. Do a skeletal survey on children less than 18 months old who are suspected to be physical abused, not a babygram. A babygram is not a skeletal survey. Then refer the child to your child protection team if you suspect child abuse, because this team will include the social workers who are indispensable members of the child protection team. And of course, do not forget to get the parents' consent as well as the child's assent to do the medical examination. As physicians, we are mandated to report suspected child maltreatment to any of the following agencies: your local social welfare officer, the Women and Children's Desk of the Philippine National Police, can also refer this to the NBI, to the Commission on Human Rights, or to the barangay. A call to your local WCPU will do, and the child protection team of the unit shall look into your suspicion. A directory of the country's WCPUs is available at www.childprotectionnetwork.org. To date, there are 113 WCPUs and VAUSI desks all over the country. So, to summarize, the incidence of child physical abuse is likely to increase during this pandemic, as it has happened in previous health and socioeconomic crises. We physicians have an important role in ensuring the safety and protection of all our children. The key to recognizing and suspecting child physical abuse is to be aware of inconsistencies in the medical history, suspicious findings on our physical and clinical examination, that is, know who the vulnerable children are and the familial risk factors to child physical abuse. Recognizing child physical abuse, adequate handling by referral to a child protection team, reporting to the local authorities are of paramount importance to prevent mortality as well as physical and mental morbidity. The prevention and response to child maltreatment has been curtailed because of the ITAF, who said, we, particularly children, should stay home all day. Likewise, places where children used to go to the Child Protection Network programs are no longer as accessible to them during this time. Next, trying to keep children sane and safe within our four walls can put a lot of stress on parents who may already have their own personal concerns. Hence, the risk of child physical abuse is higher with the social isolation that needs to be implemented. I hope this talk on how to recognize and manage child physical abuse during this pandemic will be helpful to you. So we can tell the community we are still here working for you. Dahil, quoting again Dr. Tony Dance, tayong mga Pilipino ay magaling mag-alaga ng ibang tao. Approve? Thank you.
Ako, approve ako. All right? And dear listeners, if you approved of that last slide of Dr. Naomi, dito sa Zoom, meron niyang approve di ba? Approve din kayo. Okay? Yes. Naomi, I salute you because you being a subspecialist, a pediatrician at that, but you are for this child advocacy on abuse. No? So,
may puso.
Yeah, may puso. Oo. Ako nga, while you were talking, I was saying, I experienced corporal punishment because I come from a family of 11 siblings. Ang dami namin. And surely, I experienced that one that you mentioned about in the butt naman, walang spanking, no? Pero napakataas ng effect pala kapag spanking, no? In your slides, Naomi? Uh-huh.
Yeah, that's correct.
Uh-huh.
That actually that study was a meta analysis by Jersoff on many
Mm,
studies about corporal punishment and the effects.
that's right.
Yeah, it's
Good.
true. I myself I got spanked also, but by my dad. But I think he stopped spanking us when at the last time he spanked us. Anong nangyari? No? Kaming tatlong mga babae. He spanked us, binelt kami sa aming I think calves. We cried a bit, tapos tumawa kaming tatlo. We just laughed.
Oh.
Nakita niyo
Oh.
yun. So after that, hindi na siya nag-spank. Sabi niya, ay, walang effect pala.
Ayan, okay. Bigay tayo ng tips sa ating mga dear parents whom we're caring for. Thank you so much, Doc Naomi,
You're
for that
welcome.
very enlightening talk. Okay, if you have questions, dear listeners, please put them again in the Q&A box. Let's proceed now to our next speaker. Okay. So, our second speaker is the section head of the Pediatric Emergency Section, St. Luke's Medical Center, Quezon City, and head of the Program of Pediatrics at San Beda University College of Medicine. Let us all welcome Dr. Ruby L. Punongbayan. Palagay ko yung L niya, love, kasi in love ko siya ngayon. Dr. Ruby,
Hello. Hi.
hello,
Good morning.
how are
Good
you?
morning.
Yes.
I'm fine.
Aha. How's your dog, Chester?
Oh, magbigay ako ng toys sa kanya to ensure that he will not be, barking and be noisy.
That's right. He will. She ba? She or he? Si Chester. He should not disturb Mother Ruby Punongbayan right now because of this important talk. You're in Manila right now, Ruby, right?
Yes, I am.
Yes, I admire your mayor. Yan, ipaabot mo si Yormi mo in Manila.
Mhm.
All right. So, Ruby, I give you now the floor on your talk, preventing physical abuse in children in the time of COVID-19.
Thank you. Thank you, Diding. Again, a pleasant morning to everyone. I am truly delighted to be part of this Ako Para sa Bata conference. So I am grateful and thankful to Child Protection Network Foundation and UNICEF for inviting me to talk about a timely topic. Okay, so I entitled it Double Hit because, with the effects of the COVID in our lives, we are all confined in our homes, then it is indeed highly probable that varying forms, varying degrees of abuse may indeed be happening. So, okay, for the past 6 months, we were all holed up in our own homes. We were caught in a situation wherein we didn't know what to do. Even the international health experts were scrambling around answers to our questions. What is this COVID? What are the symptoms? How can we prevent? How is it transmitted? And all those things. And in that process, we also eventually felt the psychosocial and emotional effects in our lives, in our own homes. So, Dr. Bernie, Ma'am Bernie, in her talk last week, already mentioned that there was indeed apparently a dip in the reporting of cases during April. Remember, April was the time wherein lockdown was really strict all over the country. So there were indeed reports. However, we feel that we are still not seeing the true picture, as we believe that there are still underreported or unreported cases for that matter. So research shows that increased stress level among parents is often a major predictor of physical abuse and neglect of children. Stressed parents may be more likely to respond to their children's anxious behaviors or demands in either aggressive or abusive ways. The support systems that parents usually rely on, like extended family, childcare and the school, religious groups, community organizations, they were all shut down. So they were no longer available during that time in many areas because of that lockdown or quarantine orders. Even child protection agencies experienced strained resources with fewer workers available. They couldn't go out, making them unable to conduct home visits. So many at-risk families may not have access to the technology needed to stay connected with friends and extended family. Uh, in the course of the months, we encountered and read reports, news and journals, and in mainstream media that there had been emerging incidents, increasing reports of physical abuse and some other forms of abuse during the lockdown in England, in the US, and these were all reported. There were a surge of cases being brought to the emergency rooms for these conditions. So with these increased reports, we felt that we really had to do something. So the objectives of the assignment given to me are actually to provide anticipatory guidance. So in the course of anticipatory guidance, as we dish it out, as we provide them to the families, we would like to identify the risk factors for both victimization and perpetration of abuse. In the process, we would like to highlight the more important ones. We would like to find out ano ba yung mga protective factors for abuse. And also, the third would be to elaborate on strategies used in screening for physical abuse. I'm going to share newer ones aside from the usual forensic history taking that we are to do, and then eventually discuss with you anticipatory guidance to be provided during the pandemic. Okay, here, I'm going to paint you a scenario. Imagine the lockdown scenario during the past few months. And as you can see, the pictures here depict, I would call, no, parang middle class, maybe to upper class family. Yes, they are holed up in their own homes, but look, they have gadgets, they may have access, good access to internet, they are still connected to the outside world, they may have high-tech toys to play with, meron silang mga ginagawa. The parents eventually were recalled to work either physically or still encouraged to work from home. At least meron silang ganitong scenario na natuloy sa everyday life nila. But look at the other scenario. What about if this is happening in our setting wherein I'm talking about marginalized families? Okay, here, imagine this. Alam nyo naman yung mga marginalized families natin from really the low socioeconomic strata, they barely can move around. Imagine the impact of this, being physically and socially isolated. They fend for themselves. Ito yung mga hand-to-mouth existence. So imagine the impact on their lives. So with this scenario, I'd like to start by the risk factors for perpetration. We'd like to identify first for victimization. This was mentioned before by Dr. Naomi. We are looking into the high probability that this is happening, especially among the younger ones, the younger than 4 years, which make them more vulnerable. And we take note of those with special needs. They are at high risk for being abused, especially those with physical disabilities, children with mental health disorders themselves. Some may have, hindi pa nila alam, pero baka may conduct disorder or oppositional defiant disorder. Hence, they are also vulnerable to being physically and emotionally abused. These additional factors in these children increase caregiver burden. Okay, so we're looking at risk factors for perpetration. We can divide it into several. Pwede may individual, may family risk factors. all of this can be gleaned as we do our careful history taking. It's part of our forensic training to ask these pertinent questions. Look at the parental characteristics. Ano ba yung mga parental characteristics? Are they young parents of single parenthood? Do they have jobs? What is their educational attainment? Do they have large number of dependent children in the family? Now, for the non-biological transient caregivers, look at the dynamics at home. Who is also accompanying the other accompanying members in the family? Is this the mother's boyfriend or the female partner of a father? Okay, all of this might play in the role in the context of possible abuse, and parental thoughts and emotions that tend to justify or support maltreatment behaviors. For the family risk factors, as we do our history, we ask about stressors in the family, separation, tuluyan ba siyang nawalan ng trabaho? Okay, or was there previous violence at home? Okay, parenting stress, poor parent-child relationships, and negative interactions. I highlighted their social isolation because in social isolation, as I said, you're not only physically confined to your homes, to your maybe small bedrooms, especially in our setting here in the Philippines, in the urban poor, but you feel that there was lack of communication. Aminin natin, hindi lahat mayroong smartphones. Yung ibang may smartphone, walang pang-load. So wala silang connection to the outside world which they could do so freely pre-COVID days. For the community risk factors, we look into reports, barangay, police reports. Has there been some community violence which could add to perpetration and concentrated neighborhood disadvantage and poor social connection? So, ito yung mga neighborhood disadvantage. Baka merong mga malapit sa kanila sa household na easy access to alcohol. Has there been history of drug dealing in the neighborhood pre-COVID days? All of which, again, when present, may compound the possibility of, the parents getting irritated, aggressive, violent, and eventually abusing the children. So, we also would want now to highlight the protective factors. Remember, with anticipatory guidance, we are working in 3 levels. But with my assignment, I would like to highlight the primary prevention, which is, of course, identifying what we can do in order to prevent the abuse to occur, and also screening, which is part of secondary prevention. We already would want to identify those who maybe actually are abused or at risk. Okay, the problem is already there. We just want to identify and screen them properly. And put them all together, we can now formulate our age-appropriate anticipatory guidance. For the family protective factors, we would like to find out, kumusta kayo sa bahay? Meron bang lola or lolo o may kasamang yaya? O kung halimbawa dun sa mga low-income family, sino-sino ang kasama ninyo? Ang kapitbahay ba ninyo? Nagtulungan ba kayo? Nagbigay ba ng bigas o nagbigay ng isang delata just to, tide you over during the pandemic? Was there concrete support for basic needs? How was the government in your local barangays helping you? Naibigay ba ang ayuda? Ang social amelioration funds ba were appropriated? Do you also have a voice? Did you had the privilege to talk to your barangay officials about it? And we look into nurturing parenting skills as well. We would want to find out how they are coping and how they are taking care of yung mga kids na basically nagugutom and yet needing also emotional care. So, stable family relationships, once identified, actually is a protective factor and may decrease or mitigate and even prevent the occurrence of abuse. If there is a good job and basically an educated or informed parent, an empowered parent, is a protective factor to prevent abuse. So these are all the factors that we need to identify habang kinakausap natin sila. Is there adequate housing and access to health care? Di ba naka-lockdown? Bawal lumabas ang less than 21 years old. So may curfew pa. So, paano nila na nagawa na magkaroon ng consultation with their primary doctors during the lockdown. So kailangan nating malaman yon, and as well as identifying those who have access to telemedicine. Eventually, mga doctors and other professionals were able to do teleconsultations in June, July, as we set up our own practice online, as we adapted to the changes brought about by the pandemic. We would also like to find out, are there any other caring adults outside the family? Maganda ba ang support ng relatives as well as the immediate neighbors? For the community, as I said, very vital and of paramount importance is to identify if there is an existing system and process that they can go to, okay, aside from the barangay barangay officials and the office there, to look into and take the first steps in taking responsibility for preventing abuse. Now, part of anticipatory guidance is for us to have strategies as physicians, as clinicians, and also as social workers, all the other professional personnel who are taking care of abused kids. Number one, make violence or abuse a potential part of every assessment. Okay? Yung real scenario na nangyari. Let us review the past few months. Sabi nga natin, hindi agad nagkaroon ng teleconsultation access. It was only in June or July when the restrictions eased up. But ang nangyayari ngayon is when they do consult us, this is because of simple cough and colds, maybe diarrhea, some abdominal pain. But then again, I would want to encourage everyone to still include pertinent trigger questions during the consultation. After the consultation for a medical problem, you would also want to look into their psychosocial adaptation during this time. So how do we do that? We give actually parent-caregiver interview. Pre-COVID days, meron tayong mga screening questions for this. The interview, as I said, the history taking would include identification of family stress levels and how parents manage stress, and inquire about the co-parenting relationship. Back in the day, okay, a few months back when all were still normal around us, we could easily observe mother or father-child interaction during well-child visits. However, this now poses a challenge during this time. As we can see, it's only telehealth. So limited lang yung view natin. Who's to say na, di ba, pagkatalikod after that brief teleconsultation, they other or the some behaviors of the parents, although they may not still be aware of it, may nangyayari na palang varying degrees of abuse. So, dun sa history taking na yon, we also ask for substance use and any recent increases on the part of the parent. We look for telltale signs. Sabi nga ni Dr. Naomi, signs of stress, irritability, and depression in the parents, the demeanor, the way they talk, the tone of their voice. And halimbawa, no, may mga scenario na ito, karga yung anak, pinapatingin for a possible URTI problem o upper respiratory problem. Look for harsh responses to child behaviors. Kung halimbawa parang medyo malikot yung child in front of the camera, and then you can easily ask them, observe them. Kasi, tumigil ka dyan, iyak ka ng iyak, matatamaan ka sa akin. Look for those cues. Listen, look, and feel around. During the child interview, during pre-COVID days, and of course, I am encouraging, even now at present, look for signs of fearfulness or dysregulation in children, how they handle their emotions. Do they feel, do they look to you as parang takot na takot, anxious looking, not looking at you at in the camera or in person, or maybe avoiding eye contact, and some other obvious behaviors in the body movements that again would tick you for possible some form of abuse, and look for indicators of controlling behaviors in children. Tingnan nyo paano makipag-interact sa magulang. Baka naman mamaya sumasagot-sagot, eventually the mother or the father would tend to agree with the child. You could see there in that situation how they actually deal with each other. So now, by doing so, we would like to identify families who are at risk for violence and abuse. We would want to eventually mention or possibly paint scenarios in our mind so that we will anticipate the possible problem. Okay, this slide, okay, this is PED-HITS. This is short for pediatric history taking, identifying hits: hurt, insult, threaten, scream, and sex. This is a relatively new tool that we can use. Locally, we still do not is heavily using it or actively using it, but this is a short validated tool easily administered in clinical settings to screen for physical and sexual abuse. So if this is a Likert scale, so 5 questions lang. So our question is, during the last year, how would you estimate that an immediate family member did each of the following to a child? So rarely, sometimes, fairly often, frequently. So the Likert scale is there. The other question is physically hurt, o kaya insult him or talk down to him. The other one is threaten him with physical harm. The other question is identifying, have you ever screamed or cursed at the child or forced him to have sex? So again, assigning 1 point to each, or for each question, actually they already identified the authors of this tool, Shakil et al. And by the way, this was also published in Family Medicine Journal. The optimal cut point is 1. So pag may score pa lang na 1, it already indicates that a possible answer or a positive answer item require further physician follow-up and most probably needing evaluation by a child protection specialist. And of course, higher scores would indicate more frequent abusive behavior. The other one that I would want to share with you, again, this is done by Dr. Schuten et al. These were by a team of Dutch specialists. They came up with this mnemonic. Actually, Sputovamo is apparently an acronym from their language. Okay, so this is a Dutch screening protocol for child abuse, especially used for out-of-care primary caregivers. Yung mga napunta sa emergency room seemingly because of an accidental fall, so-called accidental fall, and yet there is you are maintaining a high index of suspicion, and the use of this tool might help you to strengthen or dispute your initial impression of potential abuse. So any positive answer suggests higher suspicion injury. So you ask history consistent with injury. This was also mentioned by Dr. Naomi. So we look into the developmental milestone. Halimbawa, 6 months old, gross motor, sits without support. So pag sinabing kasi nahulog siya kasi nagpunta siya dun sa hagdan, so how on earth na mangyayari yun? So look into the inconsistencies and discrepancy between what the child realistically can do at that age versus the supposed mechanism of injury. Was there unexplained delay? Kailan pa po ba nangyari yan? 1 week ago. So how come, bakit ngayon nyo lang po siya dinala? So look at the interim, what happened during the interval. Dig deeper, ask questions. Is the history consistent when repeated? Varying and changing stories should alert you to possible perpetrators at home. Parents and child with appropriate behavior and interaction, is it also consistent? Do they look worried? Do they look parang baliwala lang, parang oh sige, naisip lang na dalhin doon at that moment? Was there no urgency with the problem, with the matter at hand? Did the parents took adequate measures, and again, unexplained injuries. So this is just the slide that you are seeing right now is just the algorithm for those questions I just shared with you. This is under the Sputovamo checklist. Now, interestingly, okay, so syempre pag mga yes ang answer, you see there in the highlighted red box, there's a suspicion for child abuse. Again, maintaining a high index of suspicion, this is part of our screening, would now alert us to, would prod us to alert and inform a child protection specialist and or the other agencies that help child abuse. Next, it is now interesting to note, next slide please. It would now be interesting to note that this particular screening tests would indeed be interesting to know whether this will be validated also and very applicable in our local setting. Remember, these were studies published in abroad in our neighboring countries. So it would be nice for in the research field to look into this and maybe validate this for our residents, not only for our residents, but also for us clinicians as well.
Yes, Ruby, thank you for that first part of your talk. In fact, in the chat box, I viewed the comments of Dr. Emma Lianto that they're using the adolescent subspecialist HITS for the intimate partner violence among female adolescents. Thank you. Thank you, Emma, for that comment in the chat box. So you see, Ruby or Doc Ruby has mentioned to us that we as clinicians and advocates, we are now equipped with these tools, all right? So hits, and then there's something new that Sputovamo, okay, is right. These questions on as part of anticipatory guidance management. So our concern now is how to empower the parents, di ba, Ruby? So the parents are just at home, our children are just at home. And the parents are the very people who are present with their children all the time at home. So tell us, Ruby, how to empower the parents. Napaka-importante, di ba? Right,
Yes.
I'd like to listen more to you.
Yes, Diding. So that is our segue now to the second and last part of this talk. In this second part, I would like now to reinforce what you already have been doing. And for those who might have sort of forgotten, because this is actually a practical approach in thinking of proper advice, okay, anticipatory guidance. We are envisioning the possible scenarios of abuse, and hence we would like to prevent that. Okay, so for the next slide. Now is the portion wherein we give recommendations for parents. Kasi sila nga talaga yung nandun sa loob ng bahay, we ask them. They should be able to recognize the feelings of stress and worry expected given the demands of care. Kumusta ka na? Kumusta ka na the past few months? How have you been dealing with the pandemic? Understand that increases in children's challenging behaviors are typically responses that likely reflect distress from routine. Kung tayong adult in distress because of being locked down and being physically quarantined, sila din. Meron din ang mga bata na form of stress. And the behaviors that emanate from them that we see, okay, and then manifest eventually, are also a consequence of that pandemic lockdown. Some more recommendations for parents. Okay? Ask them to provide a structure. Okay? Consider structuring the day in specific segments. In that picture, there's a suggestion, a recommendation. Why not use consistent wake-up time, bedtime, meal time? Children can help plan with their day. And studies have shown that when children and teenagers help in structuring their schedule, they follow it more. They follow this better if they help to make it. So it's kind of fun to, oh, what can we do for today? Oh, we spend some time. Oh, ganito ha, 2 oras o 3 oras, mayroon kang, lalo na ngayon with the resumption of online classes, then we can easily lay out a practical and doable plan for the day. Identify when feeling activated and use a coping strategy that helps. You recognize yourself actually when you are, it's like a pressure cooker situation for us parents, for us adults who are taking care of children. We feel that, our emotions are now simmering, about to boil. So use a coping strategy that helps. You also should have a household quiet time to rest. Kung may quiet time yung bata, sasabayan din natin yon ng quiet time for ourselves. In that way, we recharge our physical and emotional well-being as well. Why not call a friend or family member in order to avoid engaging in violent behaviors? Stop what you are doing. You are about to shout. Why not call a friend and also ask help? They are there for us. Call a friend, call a relative, o yung neighbor ninyo. Now, when children misbehave, three things: redirect them, you pause, and use consequences. So when we say redirect, okay, catch difficult behavior early and redirect attention from a negative to a good behavior. Example, makalat. Kunyari yung mga laruan, yung mga small parts ng toys, kalat na kalat. Wala ka ng malakaran. Okay? Instead of saying na, ang kalat-kalat mo talaga, hindi ka na nagbago. You haven't changed at all. How many times would I tell you to pick up your toys? Okay. Pwede mo naman sabihin na, oh, I see that you are now done with playing. And I see that you are about to, parang ina-anticipate mo na gagawin niya. You are about to set it aside. Okay? So, use of more positive words and rephrasing the way your commands would be is a lot of help. Do you see the kid becoming restless, distract with something interesting or fun? Marami sa atin, what we call now in social media, plantito or plantita, we all now have this penchant for taking care of plants. Order dito, order doon. Sa totoo lang, mura lang naman yan noon. Okay? We are now interested in taking care of the living. We are all beset and in the middle of death, illnesses, unemployment, okay? Yung mga social media natin parang obituary because of our colleagues and loved ones who have succumbed to COVID and other illnesses. So, despite this negativity around us, we would want to expend our energy, displace our energy by doing something that is more productive, taking care of the living, okay? And it's fun to do with your child. Pause. Pause for some time. Ayan, nagagalit ka na, gusto mo nang sumigaw, hindi mo na mapigilan. Okay? So, what's happening is you feel like screaming. Why not give yourself a 10-second pause? Breathe in and out slowly. Do it 5 times, 10 times if you want. And then you can respond in a calmer way. Okay. Just don't shout at that moment. Alam ko it may be difficult for some because you are in the thick of things. But having this as your mindset, you will be able to respond in a calmer way. That way, you avoid also the possible consequence of hitting him or her. And use consequences. Give your child a choice to follow your instructions before giving them the consequences. So, consequences kasi would help make the kids realize that there's responsibility for what they do. But make it realistic and doable. Halimbawa, no gadgets for 1 week. Paano kung online class na? So, hindi ka pwedeng lumabas dun sa mga low socioeconomic families. Talaga namang di siya makakalabas kasi bata siya. Okay? So, make it realistic. Kung no gadgets for 1 week, I believe it is more doable that no gadget for 1 day and then follow through with the consequence. Once the consequence is over, give your child a chance to do something good and praise them for it. Offer them another activity and then shift their attention towards that, and eventually they would appreciate you giving a positive comment and praising them for it. So in this regard, in this manner, I would like also to share with you some tips based on science on raising resilient kids. Let them make mistakes. Okay, let them see the consequences of their actions. Talk about how you'll get better next time. They will learn to bounce back from their mistakes and do better next time. And praise them the right way. Focus on strategies, processes, or effort. Pwede niyong sabihin na, I can tell that you are really working hard. Hindi yung pagdating ng grades for the recently concluded school year, ano ba naman to? Hindi ka man lang nag-aral, you all have the time in the world, hindi ka man lang nag-aral, ang papangit ng grades mo. Yung ganun, hindi. You can tell that you are really working hard. I see that you have good grades. So instead of that negative remark, why not focus on the effort of the child? Teach them to manage emotions. Tell the kids that all emotions are okay. Even feeling sad, worried, confused, lonely, these are all okay, but deal with the bad behavior to set limits and teach them to problem solve. Upuan nyo sila. This is all about communication. Don't rush to solve problems for them. Especially with teenagers, brainstorm solutions to address the challenge and then discuss the potential consequences of each solution. And all in all, be consistent in becoming a role model. Strive for it. You are the parent, you are the adult, you are the one who they look up to. So why are we teaching and building resilience? This is part of giving our age-appropriate anticipatory guidance. When they are resilient, we would like and anticipate that the long-term effect would work both ways, both in the parents and in the kid. Nababawasan ng tension in the home, in the family, and they could somehow have more flexibility and adaptability in trying times such as this. Building resilience in children is not about making them tough. Resilience, the ability to recover from difficulties and manage how you feel. So for my last slide, prevention on a bigger perspective. Prevention, which again is part of giving our anticipatory guidance. We identify social norms to better safeguard children at home, changing social norms to support parents. So the approach here would be public engagement, education campaigns. Again, Dr. Madrid has already beautifully mentioned to us practical tips on how to do this as we can be active in doing altruistic and volunteerism activities in our own communities. We have a civic duty also to help one another. So why not join in information campaign when they are, talk to the barangay officials how you can help in distributing some short papers or leaflets rather, wherein there is a helpline there and some tips on parenting. Provide access to positive parenting resources. You are now into telehealth now, telemedicine. So always end the consultation, the well-child telemed consultation by offering also advice for positive parenting that they can go to certain websites such as smartparenting.com. Also, there's an interesting website, essentials for parenting aiming to develop an audiovisual presentation to be distributed for all the families. We are looking into these activities that we can share with and strengthen and adapt child helpline, reinforce and mention again the hotline numbers in their local barangays. They can also go to the Women and Children's Desk in PNP stations, Krame, and of course NBI. Bantay Bata is there, and the Child Protection Network, of course, is there. And as we do so, we eventually raise awareness of a range of professionals on their roles in identifying and reporting signs of abuse. Platforms like this that we provide to our colleagues, the teachers, the police enforcers, those in the justice system, those in the law, our co-physicians and parents and social workers, we all need to work hand in hand with this. That's why we are having these campaigns as part of raising awareness. By doing so, we are hoping, we are looking forward not only to the end of this pandemic, but also in the drastic decrease of abuse happening in our homes, in our children. And because we don't want them to be left alone. We all should work hand in hand, work together, and then we show that we love and care our children. And that's it for my talk this morning. Thank you all.
Thank you very much, Ruby. You know, that was really a very wonderful talk. Okay, so let's proceed to the open forum. There's a comment in the Q&A from Maria Dolores de los Reyes that aside from advocating non-corporal punishment, I hope parents are also taught on how to adopt positive discipline, which will promote better understanding and communication with children in an age-appropriate manner. So, and actually, that's the main point of Dr. Ruby Punong Bayan, di ba, Ruby? There's a very nice comment by Joanne Josephine Benitez, no? A very long scenario because she has read in parenting books that a spanking is just fine if you have a designated spanking area in the home. And she said that she read it from the parenting book. And we are now inviting, actually, I'm so sorry. We'd like to invite already our panelists, Dr. Ruby Panambayan and Dr. Naomi Poca, to please come forward. Okay, show your beautiful faces now in the screen. Okay, so that we can talk about this practical issue. So I chose this practical issue because the others, the theoretical part or the data or information, you can search it actually. But when it comes to this practical side, there's so many sides to it. So that Josephine Benitez said that on this parenting book that she read, there is a spanking area in the house, and that the parent will have to do his or her own physical punishment, but not at the height of emotions. So the parent can do that, but not at the height of the emotion and not at the height of his or her anger. Still do it and then process it with the child. Can you comment on that, our dear panelists? I'm not quite sure whether beauty first. Pareho naman kayong beautiful.
Beautiful naman
Alright.
kaming dalawa.
Oo nga. O, since
Well,
ikaw, Naomi, ang
actually-
unang nagsake.
No, actually, I typed my answer already to that question.
Oh, that's why pala it disappeared in my screen. Alright. Okay.
No, that's
Buti na
fine.
lang.
No,
Alright, good.
what I wanted to share is that first, I hope the spanking area is not in the banyo, or else the child will not want to go to the banyo anymore.
Mm.
No, actually, I was saying because you said also that then you discuss the rules that was set. So I told her, my answer there was, if you already had discussed rules, and of course, I'm sure you will have discussed sanctions between you and the child, if you all agreed on that, instead of spanking, sit down and talk about the rules. Said, what did we say about, not going out without permission? What did we say about, okay, so let me hear from you. Because as I said, if you're going to hear the child's reasons for this, it's one way of getting to know how the child is thinking. So if you know how the child is thinking, then you will know na mukhang mali atang ginagawa niya. Or like, oops, ako pala ang may mali, or something like that. I didn't get my instructions clear, or whatever. So since you already have that set rules and this, then talk about it. A spank is still a spank no matter how you do it.
Right. Okay. Wow, napaka-quotable quote. A spank is still a spank no matter how you do it. All right. How about you, Ruby?
Yes. Hi, Joanne. The doctor who asked that is a colleague of mine. Hi, Jo.
All right.
The
Okay.
important part in all of this, halimbawa, no, talagang hindi na iwasan. Let's admit, sometimes this gets the better of us. Halimbawa, hindi na avoid talaga, na spank, na hit. Okay? So the processing of that would come into play later, and that would be the important part. They have to understand why it was done, and of course give some time for your emotions to simmer before approaching the child again. Otherwise, pareho pa kayo. Kung right after noon, yung alam mo yon, yung like minutes or seconds na spank mo siya kasi ganito yung ginawa mo kaya kita napalo, it won't work because the child would automatically be, still crying, screaming, sumasagot sa'yo even. So not really at the height of emotion. But then again, as Dr. Naomi said, we are advocating that as much as possible, we are avoiding, even if it's nasa culture natin, ang physical discipline, corporal punishment. We are trying to avoid. That's why we are here advocating positive parenting skills.
Okay, that's right. Talking about practical issues, we would really have a never-ending discussion. But let's move on to a clinical question. I think I know this person, Miss Shalane Tolentino. So, she's a doctor in a far-flung area in Bicol. So, how can we differentiate APCD or hemorrhagic disease of the newborn with AHT? I think this was a talk of Naomi. Is there a diagnostic procedure that can help? Some neonates are brought to us with subdural bleed on CT, and it is often difficult to differentiate between the two.
Yeah, okay. That's a very good question. Actually, that was one of the cases of abusive head trauma was actually a vitamin K deficiency case. So when I read the histories of the Viber, that's nothing, But the thing is, what happened was, so you really have to be very quick on this. It's your history. Because in the hospital they go to the emergency room and then they go to the wards, and then there's so many residents going to the wards. So these residents, they interview the mother and they were getting different stories. And even in the emergency room, a neighbor called and said, may physical abuse dyan. So that's what made the residents start thinking na maybe this is not only vitamin K deficiency, no? So we did the investigation and everything. You have a young mother left alone with this child, first time with a 5-year-old. Biname yung 5-year-old. That's why very important is your history. And a lot of questions, a lot of digging up in a very non-judgmental way. It's like, I just want to know what happened and things. And no, you don't make any comments or whatever. So just be very curious. There's no really, you cannot, because there are reported babies with hemorrhagic disease, vitamin K deficiency presenting with subdural hematoma. There have been reports, but it's the questioning that you ask. It's just being, again, suspicious. Kailan
Right.
suspiciosa ka siya, chismosa.
Oh,
May I
chismosa,
add
no?
to that?
Oh, yes, Ruby. Yes, please.
May
Yeah,
I add
add.
to that? Yeah, very
Wait.
important
I will pause for a while. You just go ahead. My battery is going low. All right.
thing.
Okay. Just proceed, please.
Okay. May I add to that? Tama yung sinabi ni Dr. Naomi. Talagang for us clinicians, it's still maintaining a high index of suspicion. As a PEDIA ER consultant who still goes on duty despite the pandemic, yung mga ganito na na-encounter namin with possible abusive head trauma, okay, with the background of a differential, pwede mo kasing isipin, pwede naman talagang medical problem lang, like
Yes.
hemorrhagic disease or vitamin K deficiency in the newborn, as what Mitch mentioned. Hi, Mitch. So, for VKDN, once you've already ruled out, okay, alam natin yon as doctors, VKDN, what are the risk factors, okay? Born at home. Why is that a risk factor? We aren't sure, we aren't 100% certain that the baby born at home received the essential standard newborn care, which includes, of course, administration of vitamin K. Baka, alam mo yon, baka kulang yung naibigay na steps. With that in mind, pwede rin tingnan mo, baka naman purely breastfed. Of course, exclusive breastfeeding is what we are advocating. But then again, in this context of possible VKDN, supposedly vitamin K levels is not as high in the breast milk, is not as high compared to cow's milk. So these risk factors strengthen your clinical diagnosis na ay mas mukha siyang VKDN kasi born at home, baka walang vitamin K, ay exclusively breastfed siya. All those medical risk factors, papasok dun yung sinasabi ni Dr. Naomi. After that, entertain the differential. Paano kung possibly abusive head trauma? So then again, careful history taking. So that's it.
Yeah, right. Paumanhin po sa mga ibang non-doctors, since the webinar is Child Protection 101 for doctors, bigyan na natin ng importansya ang mga tanong ng mga doktor. Kasi meron namang Child Protection 101 for teachers and guidance counselors in the next webinars. Last question, and I got one question from FB. Para sabihin naman ng taga-FB na hindi sila ostracized, ano? So the question, I don't know where this is coming from whom this is coming from. When we suspect or encounter an abuse in the clinic or ER setting, how can we communicate this to the parents? This is in the context that parents might be the perpetrator. So dito napapasok yung communication skills. I think the person who asked this is more interested in the way you would say it. Who would like to start answering?
I can share our experience. You're talking about ER, right?
Oh, right. Yes. ER ang question niya. It can be ER or in the clinic.
Okay, because in the ER, she was immediately handled by pediatricians who were aware of subdural head trauma, subdural abusive head trauma. So after the CT scan was done, they kind of hinted already to the parents that this could be child abuse. But anyway, so they called me and then we worked with a social worker. Eventually we had a family conference, and in that family, but remember, first is the doctor should not handle this case by themselves. They should be working with a social worker. That's number one, because that's what we did. So I worked with a social worker in that family conference. I had to tell the parents, look, you know, you don't need to tell me any, I'm not saying you cannot explain to me these injuries or tell me what happened to the child, but based on what we see, the CT scan, there's a bleed, there's a fractures, etc. This could only have been caused by an adult who hurt the child. So I didn't say, and didn't mention any names, although may suspicious na I have a suspicion already who. Because the mother herself said, si tatay lang talaga ang nag-aalaga sa baby ko kasi I'm working. But anyway, I just said, all of this can only be explained. No matter whatever we're going to say to try to explain these injuries, these laboratory results tell us somebody has hurt the child at home. Yun lang. So, na-shelter yung baby.
Yes, yes. How about you, Ruby? How will you address this?
Yes, I would agree that addressing it in a straightforward, professional, calm way is still the best approach. Kailangan maintindihan nung parents na yung mechanism of injury ay nakukuha lamang sa ganoon. And you have to emphasize that all other possibilities have been ruled out so far in the course of your initial investigation. And then again, re-emphasize toward the end of the conversation that you are looking into this possibility and that social workers, the other members of the team, still would be coming in for further investigation. You just have to be clear about it and straightforward.
Yeah,
Correct.
so being professional about that. All right. Without giving or putting judgment kaagad, no?
Yes.
To the
Yeah, you
parents.
try to
Yes.
maintain a neutral, calm tone.
Mhm.
Ano naman yun as doktor, di ba? Yun naman ang ginagawa natin. So, initially, no judgment talaga.
Yes. So that question actually came from Heron Avellanosa Gangoso. Ang hirap ng name mo, ha, Heron? Nagtatang twist ako. I think at this point, I'd like to thank the panelists, Dr. Naomi Puta and Dr. Ruby Panungbayan. Thank you so much for your valuable time into preparation for this talk. And if you read the comments from FT Livestream, palaging text sa akin si DV. Alright, Doc, these are the comments. They can relate to the speakers. They appreciate your presentation. So thank you so much.